This video is brought to you by Global Men's Wellness, your 24/7 AI health expert. No copays, waiting rooms, or awkward conversations. Just real answers whenever you need them. Visit globalmenswellness.com to try it free and get your own on-demand concierge-level wellness expert today. Welcome to the Global Men's Wellness. I'm Dr. Judson Brandeis, and I'm so glad you're here. When most people hear the word cancer, they imagine a single, monolithic battle. But what if I told you there's a type of cancer that, for most people, isn't an immediate threat to their life, but instead becomes a chronic condition they must manage for years, even decades? This cancer has one of the highest recurrence rates of any malignancy, demanding a lifetime of vigilance. The challenge isn't just surviving, but preventing it from coming back stronger and more dangerous. Today, we're going to explore this unique disease, non-muscle invasive bladder cancer, and the sophisticated, personalized framework urologists now use to manage it. This isn't just about treating a tumor. It's about a long-term strategic partnership between patient and doctor to outsmart the disease at every turn. First, what exactly is non-muscle invasive bladder cancer, or NMIBC? It accounts for about 75% of all new bladder cancer diagnoses. Imagine the bladder as a room with wallpaper. NMIBC is like a patch of mold growing on the surface of that wallpaper. It hasn't penetrated the plaster or the structural beams of the wall. Medically speaking, these are tumors confined to the inner lining of the bladder, the urothelium, and the layer just beneath it, the lamina propria. It hasn't invaded the deep muscle layer of the bladder wall. The survival rate for most patients is very favorable. However, the real challenge is that this cancer loves to come back. The rates of recurrence and progression to the more dangerous muscle-invasive bladder cancer are the critical factors that determine a patient's long-term outcome. The modern approach to managing NMIBC is built on a simple but powerful idea. Not all of these cancers are created equal. The treatment strategy is driven by a mechanism of risk stratification. After the initial tumor is removed through a procedure called a transurethral resection of bladder tumor, or TURBT, a pathologist examines the tissue. They determine its stage, how far it has grown into the bladder lining, and its grade, which describes how aggressive the cells look under a microscope. The urologist then combines these factors with the tumor's size, number, and location to classify the patient's disease as low risk, intermediate risk, or high risk. This risk category becomes the blueprint for everything that follows, from the type of therapy used to the frequency of surveillance for the rest of their life. This risk-based framework is a thoroughly proven and constantly evolving standard of care, outlined in the American Urological Association and Society of Urologic Oncology's 2024 guideline. This isn't just a new idea. It's the culmination of decades of research. The guideline is based on a massive systematic review of thousands of scientific articles to ensure the recommendations are backed by the best available evidence. For instance, multiple high-quality studies have shown that giving a single dose of intravesical chemotherapy, like gemcitabine or mitomycin C, right after the initial tumor resection, can significantly decrease the risk of recurrence. For high-risk disease, the evidence is strong that a powerful immunotherapy called BCG, instilled directly into the bladder, is the best treatment for preventing both recurrence and progression. So why isn't this nuanced, risk-based approach more widely understood? One major barrier is the complexity of the disease itself. Patients often hear bladder cancer and don't get a clear sense of whether their specific case is a low-risk nuisance or a high-risk threat that requires aggressive treatment. Another significant issue in recent years has been the global shortage of BCG, the most effective therapy for high-risk NMIBC. This has forced urologists and patients to make difficult decisions, often having to use alternative, less proven therapies, which creates confusion and anxiety. Communicating a patient's personal risk level and the rationale behind their specific treatment plan is more critical than ever. Take control of your health anytime, anywhere. Visit globalmenswellness.com and start your free trial today. Get expert-level answers in seconds, not weeks, without the cost, the wait, or the awkward conversations. Real support on your terms. Visit globalmenswellness.com now.